Good morning, everyone. Thank you for joining us here today. The Meridian Chamber of Commerce, in partnership with the City of Meridian, Central District Health, Crush the Curve, IDAHO, and numerous partner organizations and individuals are proud to share with you a program that will assist Meridian businesses as they reopen amidst the COVID-19. Our campaign will not only educate businesses on the basic guidelines to reopen based on the Central District Health and CDC guidelines, but it will also allow businesses to demonstrate to the public that they're doing so in a manner that will keep Meridian healthy and open for business. My name is Sean Evans with the Meridian Chamber. Our campaign is one that is meant to instill confidence in the public as they're returning to the stores and our local businesses. Online and speaking with us today are just a few of the partners and organizations that have developed this program and support the Meridian business community, as well as local businesses that are leading in best practices when it comes to safely reopening. Today, we have Tyler Jordan, a program manager with Central District Health. We have Tina Upson, executive director with Crush the Curve, IDAHO. And joining us is Hugh Crawford with Village of Meridian. We will get to open it up for questions at the end of the presentation, but at any time during this, the participants can enter questions in the chat, in the questions bar, and we'll get to those after the presentations. The premise behind our campaign was getting businesses back open and restarting our economy, and that's why our group was started. We initially pursued efforts to get everyone open as early as possible, but we saw the bigger issue of reopening amidst the COVID-19 crisis of will the public return to the stores or establishments when they reopen? We are contacted daily by our business members on how does the governor's plan apply to my business? When can I actually open? And what guidelines does my business need to follow? While the Meridian Chamber of Commerce is not an authority on the plan or the recommended guidelines, we are here to help the Meridian businesses understand them better. The last thing we want to happen is the local businesses is for them to go to the effort and expense of opening, bringing back employees, restocking their shelves, and the public, the consumers, not visit their establishments out of fear or concern for their safety. The Central District Health and CDC have developed some great guidelines to reduce your risk when out in public, and if businesses can follow these guidelines as they reopen and demonstrate to the public that they're serious about the public's safety and health, that will build the consumer confidence necessary to restart our economy. Meridian Chamber of Commerce has launched Keep Meridian Healthy and Open for Businesses to help our businesses build that consumer confidence. As the businesses open, according to the governor's 4-stage IDAHO Rebounds program, we will assist Meridian business by conducting these industry-specific webinars, like this one today. That will provide information from the Central District Health and CDC on basic guidelines for that industry. The webinars also feature local business leaders that have taken even further steps to ensure that they are reopening in a safe, responsible way. After businesses participate in the webinar for their industry, they'll be provided free of charge collateral material to display in their store that recognizes them as participating in the Keep Meridian Healthy and Open for Business campaign. These materials include door signage showing that they're a part of the campaign, posters for in-store display. The posters that we've created basically say that you check the box to open for business, that you're health monitoring your employees daily, your enhanced cleaning protocols. Employees will wear masks and gloves when in contact with the public. That businesses will require and accommodate the 6-foot distancing and social distancing protocols. That you encourage customers to use credit and other touchless contact payment methods, and that everyone follows proper respiratory etiquette in the store. We'll also provide social media materials so that you can share online, show that you're a part of the campaign. And then participating businesses will also be listed on the Chamber's website and the keepmeridianhealthy.org website as we include you in our marketing of our campaign to the public. Our program goes beyond what some other communities are doing by just creating a list of businesses that are compliant. We're also helping them understand what this means for their business and sharing best practices from other industry-specific leaders. The guidelines out there are not a one-size-fits-all solution for every business. We don't know what we don't know. These industry-specific webinars seek to educate beyond a sheet of written guidelines. As you can see on the screen here, we have some other webinars this week, coming next week, and the week after. Educating businesses on the additional protocols for their specific type of business is where the value comes in for this program, and the value communicates the safety for their employees and customers. To be in compliance with the governor's 4-stage plan, businesses will only be provided the collateral materials when their business is scheduled to open according to the governor's plan. As a follow-up after the opening, the participating businesses will be encouraged to answer surveys from the Meridian Chamber on how their opening is going and the sentiments from their patrons returning to the stores and business. This will assist us in phase 2 of our program as we build out business revitalization teams to support Meridian businesses. Be sure and look to our website, keepmeridianhealthy.org, to see the full schedule of industry-specific webinars and register for those that you would like to attend. With that, I'd like to introduce and turn it over to Tyler Jordan with the Central District Health to share with you the guidelines for general businesses, retail stores, shopping centers that are able to open as of today. Tyler?
Hello, everyone. So
we can hear you. Go ahead.
So the first thing we want to kind of discuss is when you guys start opening, we want to make sure that all your employees are aware of an employee illness policy. I think that that's going to be one of the most important things that that we discuss, is to make sure that they understand that if they are feeling ill, regardless of any type of symptoms regarding to COVID-19, they need to stay home. I know everyone wants to work right now, but this is going to be very important, and just make sure that all employees understand fully the education, the employee illness policy, and make sure that they follow those. We really want to make sure discourage employees per se, of sharing tools that they might use, phones, stuff like that. We really want to limit it to one person, and kind of limit the sharing of stuff, as well as high contact surfaces. We do recommend that businesses that have high contact surfaces like doorknobs, stuff like that, that they be sanitized as much as possible, at least once an hour. Have an employee dedicated to just going through surfaces and making sure that they are cleaning them pretty much throughout the day. If you're gonna have credit card type outlets for people to check out, have a person there monitoring it and cleaning it down after every single person that goes through, and cleaning and sanitizing it, and then bringing the next person on, as well as that person needs to be monitoring to make sure that everyone is social distancing themselves and not congregating at those registers. Another thing that would be helpful with that is providing X's that's 6 feet apart, and then just making sure that that person that's monitoring all that is really diligent on making sure people are following that. And that's going to be obviously helpful. Now, there's been a lot of questions regarding face masks. Some businesses have adopted it as far as employees or having people come in wearing face masks. That's not a requirement. That's a recommendation. You guys don't have to require people to wear face masks, but that's going to be totally a recommendation for employees or customers coming in. That's going to be something that you guys can adopt, whether you think that it's going to be doable or not. So again, it's not a requirement, but it is a recommendation at this time. And then we really want to try and see as best as possible sanitizing stations for people coming in, or hand washing stations, something along the lines of that, so people can feel safe, or if they want to use hand sanitizer, they can. Again, that might be kind of hard to find right now, so that's just more of a recommendation, but we do kind of would like to see that as best as possible. You know, and then gloves as well. If employees are part of that high traffic area, just they can wear gloves. We kind of recommend it, but again, they need to understand that just because they wear gloves doesn't mean that they're safe. I mean, any germs, bacteria can be on the gloves. So really, just because you have gloves on doesn't mean that you're totally safe from touching your hands, anything like that. Now, that being said, some things that are coming up as well is cash transactions. We try to recommend limiting cash transactions, but again, that's not going to be doable for all, you know, all businesses. That being said, if maybe one person can handle cash transactions that have gloves on, and if that's the case, then we do recommend that people wash their hands after handling each person's cash transaction. So having someone either go back and forth, or to be able to wash their hands in between each person, or having one person, you know, switch out per person, per customer, I should say, so they can go and wash their hands and keep people going. That's another recommendation we have. Consider using email receipts if possible, instead of paper receipts. Also, a lot of places are putting up plexiglass, you know, dividers between customers and the cashiers. That's another thing that we recommend. Basically just limiting the space as much as possible. But basically having someone in line to keep the social distancing, and then sanitizing all those high traffic areas is going to be the best thing for everyone. And that's pretty much what we want to see as best as possible. Other than that, maybe just place some posters out front, you know, reminding, you know, social distancing requirements, as well as, you know, putting something up of respiratory issues. If you're feeling ill, please don't come in the store, stuff like that. That'll help deter people from coming in as best as possible. And just limit or keep all single-use items available for people. Don't use reusable items that lots of people can touch and stuff like that. Basically self-serve items, you know, I mean, I know that that's probably not applicable to all businesses, but try to keep those as limited as possible. And then if another thing that might help is appointments only. If you guys can limit it to appointments only, that'll help with, you know, congregating people outside, stuff like that, that we really want to help minimize. If that's doable, that's another recommendation. And that's about all I have. Yeah.
Okay. Excellent. Thank you, Tyler. If you would mind staying on for questions as we get towards the end, we appreciate it. Yep. Thank you very much.
Absolutely.
Okay, up next, one of the most important factors that's been outlined all along is the importance of testing and tracing to slow the spread of the virus. Joining us today to talk about the availability of testing in the Treasure Valley is Executive Director of Crush the Curve, Idaho. Tina, thank you. You're muted. You did the same thing as I did. Hit the wrong button.
Can you hear me now?
Yes.
Yes? Sweet. So thanks for having Crush the Curve here today. Super grateful to the city of Meridian. Incredible what the chamber has done here, and it has really afforded me. I've had meetings with 4 other cities in the last 2 days, and it's really allowed for a template for us to use in communities around the state. So just any businesses that are within Meridian, just really, you're fortunate to have this kind of leadership. So grateful to be here and be a part of this. If you want to go ahead and move a slide for me, Sean, what I'm going to quickly touch on and try to just cover today is going to be the availability of testing, because that's a lot of what gets talked about, and then just some employer protocols and some suggestions. And we're going to see more and more of this come from the state, at the state level, and the CDC, and recommendations for this. But what I first want to address and get out of the way is testing availability. When we first started, Crush the Curve started, it was formed by a board of CEOs from around the state looking to make a difference, and they wanted to tackle whatever the barrier was within Idaho in order to, whatever barriers could be there that were getting in the way of reopening the state, having enough data to do so in an educated way, et cetera. It became very clear as it was to all of us that watched the news nationwide that there was a shortage of testing kits available. And so when we talk about testing kits, what's being talked about are when I'm feeling sick and I believe I have COVID or I want to be checked for COVID because of exposure, whatever this looks like, it's the nasal swab. Those actual collection kits that were, because of supply chain issues, short and unable to have enough within our local hospitals and health systems in order to really test all of the sick. And so there was a prioritization of essential workers or one person in a car or a family that had been tested. And so the norm that we all became familiar with in the public was, even if I go in, I'm not going to get tested. That is no longer the case. Over the last month, we have worked tirelessly to secure hundreds of thousands of collection kits. We've been able to send these out all over the state to multiple different healthcare organizations and allow for the medical providers to have the resources needed to deliver on the demand within their communities. And so I'm grateful to have been part of that. So today, if anybody in Meridian were feeling sick or believed they had been exposed to somebody active for COVID, you would be able to be tested for and have this nasal swab PCR test. You would not run into some of those rate limiting actions that had to happen in order to preserve the amount of kits available. So I'm grateful for that. Here locally in the Treasure Valley, we've been really fortunate to partner with Valor Health and Emmett, but a real player that's done the majority of the testing here in Treasure Valley with us has been Salter Medical Group. And so I do have Amy here from Salter. It's really helpful when the questions go to a medical lane for her to be able to help step in, but really nothing at Crush the Curve is possible without medical providers there to execute on the actual test. And so Salter has shown up for the Treasure Valley in a major way. We asked them to move at a pace that no business is comfortable with, certainly not healthcare systems. And they showed up and they performed and they delivered, and it has been really incredible. So, when it comes to reopening business and setting those protocols for your employees, the question is, at what point are we asking an employee to be tested, to self-quarantine, et cetera? And so when we talk about somebody who's symptomatic or exposed to somebody with known has tested positive for COVID, this is the kind of test, the PCR test, that you would then be able to go and get. On our Crush the Curve website, you can take an assessment and it'll tell you based on symptoms or no symptoms where you can go and get those tests. I want to quickly cover the other test because it's gotten a lot of news, and I think it's forced us to lose sight of really a really important element of being able to test everybody who is sick. So now that that's handled, and we're lucky in the state of Idaho because that is not handled nationwide. I'll be clear. I get calls from other states asking if we can help them as well with supply. That's where it's at. But the antibody test is a really controversial one. The reason why is there's so many out there, so many different ones that came out. That being said, only 7 have been FDA approved during the Emergency Act. Ours is one of those 7. The method of doing this test is a blood draw, and we've done this in partnership with the University of Washington Virology Department. It's a quick process. You come in, they draw a vial of blood, they send that off, or tube of blood, they send that off to University of Washington, and what they're looking for is to see if you had already been exposed to the disease, if you've built up antibodies. It's also controversial because the results, we don't know what the results mean fully, right? We know at this unit of time you have antibodies, but no one is asking for people to disregard social distancing, asks from the CDC, or to not be vigilant in safe hygiene, et cetera. It's really honestly a data tool at this unit of time that allows for some individuals peace of mind. They believe they had it or they were knowingly exposed. It helps us understand those that never had symptoms that have antibodies, helps us get a better picture of how many people are walking around potentially shedding virus but haven't been sick. And then also at the state level and the community level, it's just a data point that helps us understand at what level a community has or has not already been infected. So that's the other kind of test. And this one is not the one when we talk about testing shortage that was affected. And certainly we hope that it doesn't get to that place. One more slide, I think. And when we talk about this, we're really looking for the state. I know they're rolling out some protocols. We are getting information from the federal government. But when it comes to employee testing, it's important to understand, one, tests are available for your employees. We have a lot of employers electing, they've had their businesses shut for months. They're electing to test all employees before reentry for the active virus. They don't want to open their doors and knowingly have somebody shedding virus within their organization. Some are choosing to also do an antibody test at that time as well. They're calling it a baseline. This isn't necessarily a model for everybody. There are costs associated with this. Insurance, most insurances are not paying for antibody testing at this point in time. Select Health is the only one for sure I know that is. So insurance isn't going to pay for that, the antibody. On the active virus test, you can bill insurance for that. But one of the things that Sean brought up in one of my first calls in regards to testing protocols is they're very well in the new normal in this next phase, pre-vaccine and all the things. There's going to probably be a budget or a line item that needs to be considered by organizations that helps make sure that employees are not avoid, or that would make it so that an employee does not avoid getting tested because it's cost prohibitive, right? So finding a way to budget or plan for what could we do as an organization, both that could be communicated to the public from a consumer confidence perspective, that we have strict testing protocols or safe symptom protocols, whatever it is, but to plan for what that could look like. And then we have multiple sites here in the Treasure Valley based on if your employee is sick or believes they're sick, or somebody who actually isn't sick, but maybe they were exposed to another employee that is, where they can go to get tested for active virus and or antibody or both. But it's something to definitely be considered for companies, and we'll continue to work with the state, and our goal is to be lockstep with them on what they're asking for from a recommendation perspective, and just help to kind of articulate that, and then do what we've been doing all along, which help actually facilitate that actually being able to be delivered from a supply chain perspective. Did I miss anything, Amy, that would be helpful to kind of hit on here?
No, I just wanted to commend Crush the Curve for the work. We are happy to be a partner. We know this is an unprecedented situation. The guidelines are changing. It can be stressful for businesses and individuals and families to know what to do. But I also wanted to commend the Chamber for the Keep Meridian Healthy and Open for Business. I think that's a really innovative approach. It helps people kind of stay on top of the requirements, and we're just pleased to be a partner and to be able to provide testing and work with companies to help them get back to work. So happy to hear all this information and to share more details.
Excellent. Thank you, Tina and Amy. If you'd stay on for questions as they come up, that would be great. One of the key features of this program that we're doing is bringing our business leaders, our business owners, and people that are actually running the businesses here in Meridian to share what they're doing as best practices and additional protocols or recommendations that they're doing within their stores or their shopping centers. So joining us today is Hugh Crawford with the Village of Meridian. Hugh, welcome, and would you mind sharing with us kind of what the Village of Meridian is doing with the reopening stages?
I would love to. You can hear me, correct?
Yes, sir.
All right, I wanted to unmute my button. Thanks for having us. This is an amazing program at the Meridian Chambers spearheading here. I got a chance to view a couple of the other parts of this series earlier today and yesterday, and great information is being shared, and it's very valuable to the community and our business, primarily our business community, as they try to figure their way through this. Nobody knows. Every day there's something new that we have to kind of uncover and learn about. And so having a resource like the Chamber and the organizations that you partnered with, making this information available is wonderful. This is the video premiere of my new quarantine haircut that my daughter gave me in the backyard about a week or so ago. So it's a new look for me. So yeah, the Village of Meridian, we opened 7 years ago, and our goal has always been, how do we bring the customers in and open new retailers? I mean, our mentality and our dynamic is to open and create great places. We're not really programmed to and have an understanding of how do we go the other direction and shut things down. So it's been unique for us to go through this experience. It's been learning. It's been stressful. because we have 100+ businesses that rely on the Village at Meridian being open. Plus, we have a community of nearly 1 million people that want to come to the Village and experience it. And they do that every day. And all of a sudden, that wasn't available for them anymore for health and safety reasons in our community. Fortunately, IDAHO is on the path to recovery, and the Village at Meridian is on its way to reopen. We never really closed. We remained open for essential businesses like Boise Co-op, Petco, and our restaurants to provide essential services and food for the community. So the Village of Meridian essentially stayed open. We discouraged people from gathering, but as of May 1st, retail businesses have started to open. Those that were prepared and learned and listened and put the certain measures in place began opening on May 1st. And each day a couple new retailers open. We're up to about 37 of our 100 businesses are now open. Half of those are our restaurants that are doing curbside delivery and curbside and customer takeout and delivery. And so we're ramping in as the restaurants can then open on the 16th, open their dining rooms on the 16th. So as the manager and owner of the Village at Meridian, we kind of felt like we had a really important responsibility to make sure that we understood what was going on locally, regionally, and nationally, so that we could help guide those that were looking to us for the answers. Our businesses that have leases at the Village at Meridian look to us as their landlord, as their, help us get open for business, help us understand what we need to do. We have retail businesses, we have restaurants, we have office tenants that have some, of our office tenants have 300 employees that come to work here every day. And they want to get back to business and they don't want to be working at home anymore. So with Idaho being one of the first states in the nation to reopen, we got to be one of the first shopping centers in the country to figure out how do we turn this around and reopen our shopping center, get our businesses back. And unfortunately, we couldn't just go to Google and type in, how do I open a shopping center after a pandemic? Because no one's ever done this before. So my team at the Village at Meridian led, Ramona Merrill, Debbie Smith, all the people who were very active in the community, so most people know who they are. We were tasked with create the playbook for how the Village at Meridian is going to open, because our company has shopping centers throughout the region in Washington, Oregon, California, that are a little further behind, and Utah, which are a little further behind than Idaho in reopening. They're catching up quickly, but we got the opportunity to help write the playbook. And in order to do that, we kind of established some criteria with that responsibility for guiding what not only the shopping center industry is going to be looking at, but what our company is going to be looking for, and then our tenants and our businesses, and then really importantly, our community that want to come back to the Village. And so we had to make sure that we had a real responsibility to do it correctly and responsibly. We had to understand everything that was going on around us and what might be coming down the path, because every day something changed. We'd hear one thing, and then next day we had to shift. We had to flex to meet that new demand. We had to, so our criteria was really to understand. We had a responsibility of understanding what was going on, becoming prepared, because we're going to become the resource. We had to create the tools to communicate this message out to our various audiences that were looking to us, and then executing that plan. So we had to map all this out. Again, it was a lot of responsibility, but it was a challenge that my team and I were excited about being pioneers in and figuring out what it was. I've got a little presentation, so I'm going to share my screen here. This is always scary because hopefully you don't have anything I don't want people to see on my computer, but let's see here. Share my screen. So this is.
Looks good.
John, are you seeing that now?
Looks good. Yeah, looks
okay,
great.
So this is having that responsibility of preparing and communicating and then executing. This was a packet of information that essentially our playbook for CenterCal properties to open our properties in Idaho, Utah, moving into Washington. California now is announcing that they're going to start opening retail and some restaurants starting on Friday. So this became a valuable tool for us that we got out to our tenants, to our business owners, office tenants, et cetera. So it was really a good communication piece to share the message that Center Cal's prepared, that Center Cal and the Village at Meridian understand the needs of the community for safety, for a health benefit, for the health risks. We wanted to make sure people understood that we were ready, and we took this very, very seriously. So this was a communication piece that we put together that explained to both our tenants and to the community at large what measures and what steps we took and what we've put into place, not only in the shopping center itself, but the tools that we're able to share to our businesses as they open. So when a store like the Buckle is getting ready to open, one of our first to jump in on May 1st, they came to us and said, what do we need to have in place? And we went through a checklist. And they're like, great, got it. All the stuff that you heard from Central District Health and Crush the Curve a little while ago, we feel good knowing and kind of reassuring us that our checklists were pretty complete. So we got the communication out, the experience that people, when they walk into the village, various touch points, when they pull into the property, start walking through, what is it that they want to see to know that they're safe, that the businesses care, that the village cares. So this talks about the experience and the various accommodations that we've learned that we need to provide, understanding social distancing, providing sanitation, hand sanitizers and various things around making sure we're cleaning at a much more stringent and rigorous level than we were previously, just to meet the demands and the needs. A lot of things came out of this that we didn't know before. Curbside pickup, customer pickup, from our, not only we learned that with our restaurants, but now retailers are looking at rolling this out, which they didn't really have before. So we're learning new ways of doing business that were not in play before. Making sure the shopping center is as touch-free as it can be from our restrooms and interaction with our concierge desk. So we're being operating hours, we're being very flexible with our tenants as they begin to open. That's just part of our partnership with our tenants. Instead of demanding, and this is what the lease says, no, we understand that they've got to get employees, reconnect with their employees, find out where they are, hire them, get them in place, make sure they got all the checklists taken care of, they've ordered their hand sanitizers, they've got their signage in place. Those take time, and it's going to take time for the community to come back. So we're being very flexible and accommodating for our tenants and what their operating hours are going to be, because we know they need that assistance and that partnership. We're stepping up our level of services from cleaning in our retail spaces. Our office tenants come to work every day into an office, and they want to make sure when they show up each day that the faucets and the door handles and their desks are sanitized so they can start the workday out in a nice, clean environment. And we want to make sure it's safe. We've got security 24/7 at the property. That's important to our community to know that when they come, they're not only safe from a cleanliness standpoint, but also it's safe and that we're looking out for their best interest. And part of our reopening playbook include a marketing strategy, an outward-facing marketing strategy to share that message to our retailers and to our community. We've got various message points that we're putting through the shopping center. I'm going to share here in a moment. We're supporting our tenants. They're looking for, okay, we're reopening. What can we do? How can we re-advertise? How do we let the community know that we're open? How do we let them know we're being safe? So we're working with each tenant every day, talking to them, listening to what their needs are, and helping them deliver, as well as our community. While we're in a period of shutdown, we realized there are various needs out there in the community that we found ways to support, from doing diaper drives, because we realized that diapers became a very scarce commodity. Those that needed it couldn't afford it, couldn't find them in the stores. So we did a diaper drive and had, I think, 2,000 people that came through. We had and are continuing to have blood drives. We know that's a need in the community. We've had a food drive at the shopping center. We fed the police. We've delivered food to nursing homes to feed the staff that were working, long hours. So we found certain and various needs that just had to happen, and we felt good about and wanted to do it, and it kept us, connected with everybody out that we were trying to, understand that we care. See here, so communicating that message, we created a new signage package that you'll see when you come to the Village at Meridian that reminds people about safety and distancing and how to treat others and assuring people that things are clean and safe. And when you walk around the shopping center, you'll see these in various places in our restrooms, as we made sure when you go to the restroom, you're being safe, shutting down urinals, closing off sinks, putting messages in place, making sure that we have hand sanitizers. That picture in the upper right shows hand sanitizer, a trash can by the door, because we hear people want to use a paper towel or a tissue when they open the door. So we're making those accommodations that we know our community wants. Signage throughout the shopping center, we've learned differently. Like that little picture on the left shows a sign that we put on our management office that says, hey, if you can handle, instead of having people at a moment's notice, all of a sudden we'll have 20 people in our management office lobby, and that's not safe for our staff. It's not safe for the people coming in. So we're trying to encourage them, try to make a phone call and conduct business that way, or meet somebody outside. Play areas are closed until further notice. We're reminding people, one of the issues that we're hearing in the community is people are going to the stores, taking off their gloves and masks and throwing them on the ground in the parking lots or into shopping carts. We're trying to have the community be responsible with that. Delivering our message as people walk around and reminding everybody. Taking safety measures in the shopping center to protect our staff and the community. Various acrylic barriers, so we're creating touch-free and safe interaction with the community when our staff is working with the guest on directions or selling gift cards. Picture on the right is our management office. We bought these acrylic barriers from a local company here in Meridian. Woodland Manufacturing has these and is producing them for businesses daily, and we're able to buy them locally and put them in place very quickly. Our security and housekeeping staff, we understand that they're out interacting with the community. We're making sure they're being safe for themselves and for the community with gloves and masks. We took the social distancing to a new level with all our common area seating. We used to have it all tucked nicely, clustering, make very intimate environments. We're spreading it out now so that people feel safe and meeting the demands and the needs in the community. And it's also available for our restaurants. They're going to lose seating capacity in their dining rooms when they first open. And just by spacing out their tables, we're providing more tables outside, so you can do takeout at Kona Grill or Yard House or Grimaldi's and then bring it out and sit by the fountain. These tables are available for that. So again, we understand the responsibility we have. We're trying to be as prepared as we can. We're trying to help the businesses at the Village at Meridian be as prepared as they can. So when they reopen, they're delivering the needs. And then as we went through, we're showing you how we're executing that. And every day we're flexing to the new demands. We're learning every day, and we're open now as a business, and our businesses at the Village at Meridian are continuing to open each day. That's what I have, Sean.
Thank you, Hugh. Appreciate that. Great to see that the Village of Meridian is taking all of this extremely seriously and protecting not only the employees of the businesses there, but the patrons that visit your facility. With that, I will open it up for questions from our participants. Remember, you can type questions in the question box and ask questions of any of our panelists. So I would like to get to one question that was sent to me, and this may come back to Jordan, or excuse me, Tyler, with the Central District Health. You'd mentioned masking and gloving as recommendations and not required. Does that also pertain to close contact services where less than 6 feet can be maintained?
I'm a little confused. So can you say that again? Because I wasn't sure about how the close contact.
So services that are close contact services where the employee has to be in contact with the guest, is the gloves and the masking still a recommendation for that, or is that only the recommendation when you can maintain 6 feet?
It is still a recommendation, but in order to keep your employees safe, that should probably be put in place. If like you have close contact with people, there's no way around it. You should have some type of PPE in place to help keep employees and the community safe. Yes, technically it's still a recommendation, but it is something that should be handled individually, and it should be followed pretty strictly if for whatever reason you can't maintain the social distancing guidelines.
Okay. Tina, We also have a question again about the cost. I think you may have addressed that a little bit, the cost, but for businesses, the direct cost would be, Amy?
Tina had to step out, but I can help. The active virus nose swab test is $95. The blood draw is about $100. And as she mentioned, we work with insurance. And so when a company's interested in having their employees tested, they can submit a request through crushthecurveidaho.com, and we'll walk you through that and work with you together.
Okay, excellent. Thank you, Amy. Hugh, the next question is for you. What about the Village's usual summer series, concert series, and things like that? Are there any plans to cancel those, postpone? What is the thoughts right now?
We're staying in tune with what the state guidelines are about gathering. Right now, the summer concert, the Rock the Village concert series, was originally scheduled for the months of June and July. We moved that shortly after the shutdown to a July-August schedule. That's still in play, but on hold right now. We don't know that it will be the responsible thing to have 3,000 people gathering at the Village. So we're looking at other smaller venue entertainment options that we can provide throughout the summer that would meet the community's expectations. So we're essentially on hold, waiting because we get a little closer through May and June before we can officially cancel it, but stay tuned.
Okay, excellent. Any other questions that I see here in the chat window? No, just some comments about great presentation. With that, I would just like to remind everyone that visit keepmeridianhealthy.org for more information on this program and the other free webinars. For those that attended, be sure that you complete the survey that's emailed to you immediately following this webinar to ensure that the delivery of the collateral materials can be either you pick them up or we can have those delivered to you. Remember, the Keep Meridian Healthy and Open for Business campaign is there to help instill consumer confidence in all of the businesses here in Meridian. And we want to thank all of our presenters today from Crush the Curve Idaho, from the Village at Meridian, from Central District Health, and from Salter Health. We appreciate you being on today and sharing this information with other businesses as they open up in a way to keep Meridian healthy and open for business. Thank you all.
Thank you, Sean.
Thank you.